Before start this video, please subscribe my channel and click on bell icon. Thanks.
A new study suggests that eye drops developed by Columbia University researchers could be a more effective and comfortable therapy for a common eye disease currently treated with injections into the eye. There's an opportunity to help more people with this disease that is a leading cause of blindness worldwide. The study found that an experimental eye drop treatment was twice as effective as the standard injection therapy at reducing swelling and improving blood flow within the retina of mice with. The eye drops also prevented neurons, photoreceptors, in the retina from deteriorating and preserved visual function over time, whereas the standard injections had no effect on either. Future studies are aimed at preparing to test the eye drops in human clinical trials and identifying additional therapeutic targets. Finding the root cause of RVO is the holy grail, but if we can at least provide better symptomatic relief that doesn't distress patients, it would be a really good start, Troy says. More information. The study, caspase-9 inhibition confers stronger neuronal and vascular protection compared to VEGF neutralization in a mouse model of retinal vein occlusion, was published online in Frontiers of Neuroscience. All authors: Maria I. of Rutsky, Columbia, now at Character Biosciences; Claire W. Chen, Columbia; Jacqueline M. Lawson, Columbia; Scott J. Snipes, Sanford Burnham Prebys Medical Discovery Institute, La Jolla, CA; Guy S. Salveson, Sanford Burnham Prebys; and Carol M. Troy, Columbia. The study was supported by a sponsored research agreement with Opera Therapeutics and grants from the National Institutes of Health, R01NS091333 and T32EY013933, and the Department of Defense Army/Air Force. Thanks for watching. Please subscribe my channel for more videos.